Good morning. I'm Dr. Jagadeesh, Senior Consultant Physician, KIMS Hospital, Secunderabad. So today we'll discuss, because the summer has already come, we'll be discussing about heat stroke, heat exhaustion and heat cramps. What is this heat stroke? How do we identify? How can we avoid that? I think it's pretty self-explanatory. Heat stroke is one extreme of illness because of exclusive exposure to very hot sun. So heat stroke is this extreme and heat exhaustion is this extreme. So I'll talk about heat stroke. So if anyone who has got exposed to high temperatures or significant moisture with lot of humidity and perspiration, there is every chance of them to land up in heat stroke. Heat stroke is someone who's experiencing high degree temperature of more than 104 with the history of exposure to the hot sun for few hours continuously with significant dehydration. Yes, we need to think about heat stroke. So a lot of people couldn't identify that is it a heat stroke? Yeah, there is no infection, there is no something else which is popping, there is no one particular source of infection, but still people land up in very high temperatures with sudden drain. They completely drain, they sometimes profusely sweat. So we need to think about this is one possibility, because the temperatures are soaring anyways high. So who are more vulnerable? We see pediatric age group who are usually less than 5 to 8 years, and we see the extremes of other age, elderly people who are poorly built and poorly nourished beyond 60 to 65 age, most preferably beyond 70 age group. So we have to be very careful in particularly summers to make sure they are always placed under good shade. They shouldn't get exposed to very high heat, preferably in an air conditioned room, if not at least a cool place, rather than leaving them under the hot sun, or even under the roof also. Sometimes it is very heat in dry areas. This is something one has to remember. Second important thing is, make sure this particular vulnerable group are hydrated significantly in this summer days. This is other important thing. And travel is other thing, because summer is there, people do travel a lot from here to there, but are we hydrating ourselves significantly, as well as are we not getting exposed to the hot sun? So once you think about someone has got very high temperatures, immediately rush them to the hospital, because that cannot be treated at home. 103, 104 temperatures can be handled only at hospitals. The patient has to be shifted immediately to the hospital, immediately started on the IV saline. We have to hydrate them, we have to significantly give them IV fluids so that they maintain the volume inside the body. Apart from that, we have to do cold sponging. Keep a wet cloth in water and try to sponge all through the body for a repeated number of times, so that the temperature settles down. So treating heat stroke is as simple as identifying is the challenge. So important is identify the patients, identify the right vulnerable group, and take them to the right time to the right doctor.